Hello, my name is Robert Giugliano. I'm one of the TIMI trialists and cardiologists at the Brigham and Women's Hospital. And I'm here today with my colleague, Christian Ruff. Welcome, Christian.
Thank you very much, Bob. Great to join you today.
Yeah, today we're going to be talking about one of our ongoing and exciting TIMI trials called the LILAC study, and it's investigating atrial fibrillation. And for many of you tuning in, you already know atrial fibrillation, very common, in fact, most common serious arrhythmia in the world, increasing in prevalence. If you live long enough, you have a 1 in 3 chance of developing atrial fibrillation in your later years. And so important that we discuss new treatments and, what the future might hold. Christian, tell me, because we both practice in the clinics, tell me about your experience with atrial fibrillation and, the current approach and the current limitations.
Great. I mean, as you said, atrial fibrillation is certainly one of the most common things we encounter, not just all in cardiology, but all in medicine. Many of us will have it, or certainly a loved one who does. And obviously, atrial fibrillation is important for many reasons. Often patients present with a rapid heart rate, they don't feel well, palpitations. And there's a lot that goes into managing how fast they're going and getting them out of atrial fibrillation. But one of the primary concerns, as you and I are both well aware, is that once patients are diagnosed with atrial fibrillation, one of the biggest concerns is their substantially increased risk of stroke, on average about fivefold, but that varies obviously depending on the patient. And strokes caused by atrial fibrillation are some of the most deadly and lead to the biggest neurologic disabilities. So there's certainly big strokes that we want to prevent. And we know that anticoagulation or blood thinners are the main way we reduce that risk of stroke. And for over half a century, we just had warfarin. And obviously, warfarin is very effective, but it's one of the most difficult and dangerous drugs that we use in clinical practice. And then you and I were involved in some of the seminal work for the DOACs, which have been a major transformation in the treatment of atrial fibrillation, in that they're just as effective as warfarin in reducing stroke, and warfarin's highly effective, but they were much safer, but much safer with respect to serious or life-threatening bleeding, particularly bleeding in the brain, which is devastating. But the one problem is they still cause a lot of bleeding, a lot of gastrointestinal bleeding, which is the most common type of bleeding we see, a lot of bruising, et cetera. And that leads to significant undertreatment. And we know, and it varies depending on the study, that somewhere around 30, even up to 50% of patients are not receiving an anticoagulant, not receiving a DOAC, or take it and then subsequently stop because either they bled before or they have a fear of bleeding.
So how might we thread the needle here with alternative therapies?
Well, one of the exciting things is the emergence of the factor 11 pathway inhibitors. And the unique thing about factor 11, which is another protein in the coagulation cascade, is it's quite unique. It seems to be critical for pathologic thrombosis, forming a clot, say that causes a stroke. But it's not necessary for normal vessel repair. We call that hemostasis. So factor 11, unlike warfarin and the DOACs, prevents bad clotting, which is having a stroke, but seems to not interfere with good clotting, which is if a blood vessel is injured, you're able to repair the blood vessel. And from the early studies that we've done and others, that appears to be true, that these drugs, these factor 11 pathway inhibitors, are remarkably safe, far safer than any anticoagulant we've ever used. And obviously, the next step is then, are these drugs effective in reducing stroke? And obviously, we're working together on the LILAC-TIMI 76 trial.
Yeah. So I think, why don't you share with the audience, the question we've asked in the LILAC trial and a little bit about how that study's designed.
Sure. And there are several studies that are being done with factor 11 pathway inhibitors in atrial fibrillation. We're focusing on, I think, the greatest unmet need with LILAC-TIMI 76, and that's patients who are high risk and who are untreated. So these are patients with atrial fibrillation who are at high risk of stroke, who have been determined by their healthcare providers to be unable to tolerate currently available anticoagulants, such as DOACs, and they are not able to receive a left atrial appendage occlusion device. So they're at very high risk and they're completely unprotected from the risk of stroke, mainly because they have a very high risk of bleeding. So I think that's probably the biggest unmet need for anticoagulation atrial fibrillation. And so the LILAC-TIMI 76 study is enrolling those patients, and they're being randomized to either placebo, which is what they're unfortunately getting now because they're not eligible for standard of care anticoagulation, or abelacimab 150 milligrams sub-Q once a month, which is one of the novel factor 11 pathway inhibitors And the primary endpoint for this trial, as in all stroke trials for atrial fibrillation, it's going to be ischemic stroke and systemic embolic events. And of course, we'll look at bleeding. And we feel this is an incredibly important trial because if you look at atrial fibrillation, which is a disease of the elderly, the patients who are most in need of a new, effective, and vastly safer anticoagulant are these patients who currently have a class 1 indication for it, but are simply too high risk of bleeding. They've bled before, they have other conditions that predispose them to bleeding, that they're currently not receiving anything. So we're very excited about this trial.
Yeah.
We think it would be a really important transformational advance in the protection of patients with atrial fibrillation.
Well, thank you, Christian. That was really terrific. Quick update on novel therapies in atrial fibrillation and a particular study that we're doing, the LILAC-TIMI 76 trial in patients who are currently not eligible for a standard anticoagulant. It's a very important study.
Great. Thank you, Bob.
Thank you.